and I'll ask the committee to allow me to set that date as soon as we know when sitting resumes for the House itself. I am also proposing that we also invite the Ministry of Economic Growth and Job Creation, in particular NEPA, to look at the mining license for the dry harbor mining out in St. Anne. And I'll also propose that the Ministry of Culture, Gender Affairs and Sports also attend on the committee, in particular the JCDC, and looking at in areas of the independence and emancipation celebrations and the annual festival competition. So I'm putting that to the committee also to be included in our proposed schedule. Members? So we have three ministries and departments and agencies that we're going to include into the schedule. So that will be the Ministry of Local Government and Rural Development, dealing with those three municipal corporations. I will also add to that if we can also ask the ministry, since now that NESL is under the Ministry of Local Government and Rural Development, if we could also invite NESL to submit a report, which is the Rural Electrification Program. Invite NESL to also attend upon the committee.
There is no NESL anymore.
No, well, the Rural Electrification Program, then, right, to look at. Seeing that there was a allocation that was given to us when the rural electrification was over in the Ministry of Energy, and there was an allocation to each constituency of about $3 million, which we have not. So just an update on it, and so we'll get the report and then determine the next step. All right, if the committee agrees on that. All right. So we're in agreement that we invite these three ministries and the agencies as I stated.
Yes, sir.
Yeah. Members, rest of the members, good with that? All right. Madam Clerk. Okay. Is there any other matter arising? None? All right. So we can move into new business. You can invite the ministry in, please, or ministers. We're going to start off with the Ministry of Education first. So I'm going to ask the ministry to come. You can, Sabra, I don't want you to go too far. Good. All right. Good morning, Madam Pierce and your team. Welcome to our new setup at the House of Parliament here. Am I not looking comfortable? Yeah, no. It's a little bit off center of that side. I prefer to be closer to you. Thanks for responding to the requests. Today's sitting, we're basically just trying to get an update on the situation with the matter of the COVID and the new dispensation with our schools, and just an update on where we are and how we've been doing and what is it that we can look forward to, especially in the new year. So I'll invite you to introduce your team and to make your opening remarks.
Thank you very much. Thank you very much, Chairman, and good morning again to you and the members of the PAAC. This morning I have with me Mrs. Sonia Banton, who is our Principal Financial Officer, Mrs. Vivian Johnson, who is our Senior Director responsible for planning and development, and as specifically relating to our schools, the evaluation of the pilot schools that have started the face-to-face reopening, and Mrs. Philippa Grant-Smith, who is our Project Director. So, Chairman, contained in the report that was submitted, we sought to respond to some specific questions that were asked, and I will just summarize briefly some of the areas that are included. So the first question actually asked us about the plans for the reopening of schools based on the number of times that we had to push back the opening. We have continued to work very closely with the Ministry of Health. We seek their guidance as it relates to the opening up of our schools. And so earlier I think it was in July, when we indicated that we would have opened on September 7th, then we started to see the cases increasing, and so we had to change that date to October 5. Now, prior to the October 5 date of the official opening of schools, there were a number of activities that we actually carried out with our close to 1,000 public schools. We ensured that we updated the Education in Emergencies Manual, which speaks to the general administration of education from the administrative perspective. And we also did a thorough review of the education component as it relates specifically to the adaptation of the curriculum, and guidelines were also provided in terms of what the ministry would focus on for the new school year. Now, based on the guidance that we received and approval from Cabinet, when we commenced on October 5, we commenced with 3 modalities. The first one is online learning, the use of audiovisual materials and stations, which would have included our 2 main television stations and the PBCJ. And we also developed what we call learning kits, which really is the packaging of material based on the curriculum for those of our students who were not able or are not able to access any of the virtual platforms or any of the television and radio stations. So those 3 areas, we started off relatively well, but of course we were impeded by the number of students who had tablets and who are able to access the internet, and we have seen significant improvement since then, and I will give you a further update regarding that component as we move forward. So we got our new ministers somewhere in September 14, I believe it was. And once they were briefed, there was an approach that was suggested, which of course included using the geoinformatics information to determine or to look critically at the communities with the highest level of COVID cases and to look at the schools in those areas and to determine if we could actually use the statistics to determine those schools that would have been at lowest risk. So from this analysis that was done, we came up with 73 schools that we felt were at lowest risk. Some of these schools were already inspected by the Ministry of Health, but of course we knew that there would have to be reinspection. And we selected 17 of these schools, and we commenced the pilot the first week, I believe it was in November, of these 17 schools after they were cleared by the Ministry of Health. The pilot has gone very well. The first week of the pilot, there were some issues in terms of the management of the lunch sessions for about 2 or so of the schools, as well as the school's ability to manage medical emergencies. By the end of the second week of the pilot, those issues were resolved, and based on the evaluator's report, we had very few areas that we could consider unsatisfactory. And we currently have the full evaluation report that we expect that our minister will share with Cabinet and Parliament for some time next week. But we can say that the pilot was a success, and it will now pave the way for us to make the adjustments that need to be made as we move forward with the reopening of our schools. Now, as it relates, Chairman and members, to the provision of the necessary equipment, as I mentioned before, tablets for our students. By the September of this year, we had actually completed the procurement of the one set of tablets, 40,000 tablets for our students who are on path. The ministry took the decision to distribute these tablets to our students at grade 4 to 6 so that they could actually commence or continue the preparation of for the primary exit profile. And to date, we have distributed 34,164 of these tablets to 766 primary schools, and we expect that by the end of the year, we would have completed all the students on path in grade 4 to 6. We also had commenced the distribution of tablets to our teachers. Of course, many of them now have to work in the online environment. And so in addition to the training of the teachers, we have also distributed 23,563 tablets, and there are some appeal cases that we are currently working on. Now, Chairman and members, as it relates to the monitoring of the system within itself, we actually do this on a daily basis, and in the report you would see where we actually detail the logins to the learning management system, which the ministry was able to set up. And through our partnership with Digicel, students are able to access this without the utilization of data on the Google management platform, and many of our schools are actually using this platform as we speak. So as it relates to the full monitoring, the attendance of our students based on the information that we have shows that on an average we have 65.2% of our students being engaged in one of the different approaches, whether it is virtual, audiovisual, or learning kits. And when we compare this to the student attendance for 2019, which is 80.2%, we are about 15 or so percent below what we had in 2019. Now, I just want to touch a little on another area you raised, Chairman, which has to do with the diagnostic assessment. So we indicated to the nation that we would have conducted a thorough diagnostic assessment because the ministry would have predicted, based on really the parameters that we have in place, that there would have been significant learning loss since we closed in March, and the different modalities, and of course many of our students not being engaged. We have so far done the analysis for the primary level. The analysis for the secondary level is not completely ready, and we have seen that yes, the learning loss has been significant. For the 4 subjects that we actually did at grade 6, mathematics, language arts, social studies, and science, we have found that there's a mean score of 23 for mathematics, 30 for language arts, 26 for social studies, and 24 for science. At grade 5, the scores are a little better for the areas that we actually assessed. Mathematics is at 25, language arts 33, social studies 31, and science 28. And at grade 4, mathematics is at 37, language arts at 43, and integrated studies at 25. So we have concluded that the learning loss has been significant, and therefore we have started our intervention plans. And one intervention plan is actually outlined in the report from page 23, which we intend to commence this intervention in December as we seek to try and see how best we can use, following the COVID protocols, we can start intervening in ensuring that we can bring up our students to the required level. You had also requested, Mr. Chairman, the number of students who are COVID positive, and I'm happy that P.S. Dunstan and the team is here, as this information came directly from the Ministry of Health, which shows that we have a total of 800 of our students who are currently positive, and that's from the infant to age 17. There was one other question that was asked about the use of, well, 2 other. One having to do with the use of edufocal and one-on-one. They provided support earlier in the year, and currently, based on the diagnostic assessment information, we are going through the procurement for the engagement of both entities to support especially our PEP and our CSEC students. The last area, Chairman, has to do with the Own Your Own Device program, which was introduced by our minister, which is the provision of or making available 36,000 vouchers valuing at $20,000 each that can be used for students at primary and secondary to access a tablet. Now, just to indicate that as of today, we have 14,133 applications. 13,000 of these persons have met the criteria, and we have persons from all across the country and our schools who are actually applying for this voucher. We have the vendor framework actually set up for the vendors who will provide this kind of device to our students, whether it is on a credit basis or it is the single purchase. We initially had some challenges when the system just started. We have been able to sort through those challenges, and the system is up and running right now as we speak. So overall, Chairman and member, that's the general update from the ministry, unless there are questions that you would like to ask or clarification based on what has been presented.
All right, thank you, Madam Pierce. Members?
Thank you, Mr. Chair.
Okay.
Through you to Madam Dr. McLean. I'll start at the end part of your presentation as it relates to the persons or companies who would provide the necessaries, whether it be the one-time payment or the credit situation, as it relates to how is it? Explain to us the workings. How is it going to be worked out?
Okay, so the process in terms of the vendors is actually being handled by eLearning Jamaica on behalf of the ministry. And eGov actually developed the platform that we are currently using. So there are specific criteria that we have developed that will ensure that persons are qualified within the system. So once they have applied, for example, the 13,000 persons that we have indicated have met the criteria, then it simply means that through the back office work, then they will be provided with a voucher that is valued 20,000 for them to take to the supplier who they choose to use, who will now enter into whatever arrangement there is with them, whether it is to purchase a tablet, if it costs 20,000 or less, or if it is more, they pay the difference. And they also in some cases of a laptop, they may have to go into a credit arrangement with the supplier. Now, as it relates to the supplier, there is an eligibility criteria that has been developed by eLearning, which means that these suppliers actually should have met all the criteria based on the procurement guidelines. They should, at least, there is evidence of their business name and registration from the Companies Office of Jamaica, valid tax compliance certificate, valid procurement commission certificate, manufacturer's authorization, description of warranty and service, as well as they should present their credit terms. We have also provided them with the specifications for the laptops and the tablets, so they also have to meet that criteria. My understanding, sir, is that the e-learning company has met with the vendors. They are in the process of completing the application forms, and then the selection will be done in another 2 weeks or so for those vendors that will be made available. So we have been advised that within another 2 weeks, we will be able to process the number of applicants that have met the criteria, and around that time, we will also ensure that we send out the list of vendors so that they are able to access whichever one they choose depending on their location, sir.
We are well aware, Mr. Chairman, the reason for the government to step forward and to assist parents. We understand that many are not working, many weren't working before, and therefore we still need the assistance, so to speak. What guarantee do we have that a parent who only have that $20,000 grant from the government, that they would be able to get the assistance of one of these vendors, the credit, because then you have to have guarantees for the credit.
Right.
And if they're not working, how is it that they're going to be going forward?
Well,
what other steps are in place to accommodate that situation? Are there any?
Okay, so this particular initiative is, the value is actually 20,000. But through the discussion, sir, with the vendors, they are willing to establish credit terms for the parents who will be coming to purchase, and some of the terms are quite flexible. I am not able to speak specifically on what the detail of those terms are because they have not yet signed off fully where that is concerned. But they have committed that they will support as best as possible to ensure that they can accommodate these students. So there are different kinds of arrangements that they actually presented to us, which will be utilized. But member, just to indicate that outside of this 36,000 tablets, laptops, we also are procuring laptops for grade 10 to 13. That contract has been approved by Cabinet already, and before the end of December, we expect that we will start having the delivery to those students who are on path, and we are also procuring another 25,000 for students at grades 7 to 9, which e-learning is currently in the procurement phase. And also, sir, we have the one laptop per child initiative, which is an initiative that Minister Williams has initiated, which we currently have a number of private sector NGOs, diaspora members who are contributing and providing tablets and funds. This is being managed through the National Education Trust, and persons who are willing to give, they have a say in which school or the students. And so what we have done now, we have developed a database that is linked to the Own Your Own Device database, where we will have the information in terms of those students who have already been provided with tablets, so that there is really no duplication. So that is going to be available shortly, so we can always double check. But we know that even while we are developing the database, tablets are still being provided and so on. So it is really on an ongoing basis that we will update and make sure as best as possible that there is no duplication. And the response, I must tell you, from private sector and the diaspora in terms of provision, it really has been overwhelming. We are getting a lot of support from persons who are just volunteering to give to our students.
Thank you, Mr. Chairman. The credit situation with the vendors is what I'm very, very much concerned about. I want to know here, if you have that information, or if not, then you may seek the information and provide it to us. That is there a case where interest will be charged?
Okay, I don't have that information, sir, because as I indicated, they are still finalizing with the vendors, but I will make a note of it so that that can be provided.
Because, Mr. Chairman, what we don't want is a situation, and we do understand the private businesses, how they treat with credit, that you may end up paying 2 times the amount of what the thing costs. And we are saying that this initiative started by the government is really something to assist and to support parents who are unable to purchase at a one-off. But for us to put them in a position, and I'm not saying that it has been done or it is the doing, I'm just asking that we look into it, that it does not become that end result wherein the tablet which is to cost $40,000 Jamaican, and the credit agreement you're going to, you pay the first $20,000, and then by the time you're to finish, you end up paying $70,000. I hope that this is not going to be the case. Also, Mr. Chairman, through you, whatever the end results are, that it be made known to us long before it goes into the implementing stage, wherein if there is anything that we would like to tweak, take out, or to add, or to recommend, that it get a chance to be done long before it gets to John public.
Okay, sir.
Right.
Noted, sir.
Member Hamilton, and then Member Hannah.
Through you, Chair. Good morning, PS.
Morning.
I really have a number of questions, but I will start with the last message you gave in relation to the Own Your Own Device program. There have been a number of issues relating to some students accessing their SRN. I'm not sure what the process has been for that information to be acquired, especially by the parents, but there have been a number of complaints that students are not able to access that information. And that has a direct impact on those who want to apply for the Own Your Own Device program. So far, you have mentioned that 14,000 plus persons have applied. Is it that as of today's date?
Yes. Yes.
And tomorrow is the deadline. And 13,000 plus persons would have met the criteria. But we were looking to 36,000 persons to benefit from the program. I'm not sure if there is a plan to maybe extend the deadline to facilitate those persons who are having difficulties applying for the program, especially with this SRN issue. I'm not sure if you can speak to that first, please.
Okay, so member, let me address the SRN. The ministry started a national student registration program in 2010. And when we started that program, it started out with the intention of ensuring that every single child has a unique registration number. And this was developed in particular with the parameters to support the system. So this has been in place for over 10 years now. Where we're at is that the students are provided with a student registration number, a little card with their name, their school, and their number. And we have always indicated that they keep this card in safekeeping because the time will come when they will need to refer. This registration number is actually the number that is used when we register them for the PEP exams, for example. Now, we decided that the only way that we could ensure that a child, a student, is pegged to an institution and the unique number is to, well, pegged to an institution is to use the student registration number. We are also aware that they have never used it for anything of this nature before, so there would be a little difficulty in even finding the card or remembering and so on. So what we did before the application process started, we sent the list to each school with the numbers for the students so that the parents can access directly from the schools. We also provide through the 188 Educate number, where once they call, we have the database and the number is also provided. And our checks would have revealed that from the National Students Registration unit within the ministry, the team received about 21,000 phone calls, and we have provided, except for, and this was the report from yesterday, for 250 requests that were being cleared, but we have been able to provide the numbers that they have requested so that they can put their application in. I crave the members' support in this regard, because there has to be a way for us to ensure that the benefit does not go to more than one person. So we really are trying to ensure that this system works. Now, as it relates to the deadline, we started a little late. We should have started on the 17th. We had some issues about 3 days. So in discussion with our minister, the decision has been taken to extend, to process those who have already met the criteria, and to extend the deadline for the others up to the end of December. And we also will continue to facilitate the student registration number. So we will be sending this information out to our schools and to the general public by the latest tomorrow, as we just confirmed the final arrangement at a meeting this afternoon with eGov and eLearning. So we do not expect that any of our students will be disadvantaged, because the number is readily available to support our students.
Thank you, PS. I look now to the rubric that you provided for the scoring of the
Can I just before you move to the rubric, because on that issue,
Yes, Chairman.
they're still outside of the student's registration number,
Yes, sir.
because I've been getting reports, and I can say even from my own office, where we put in TRNs are not matching up with the names, the student registration numbers in some instances not matching with the student, and there is it just keeps rejecting. I saw one parent said, it looked like the ministry want me lie, because when she put in that she's unemployed, it keep on rejecting to say that she's employed. And she said she has lost her job 3 months ago. Yeah? So there's still some tweaking, hence, because I mean, even with the forms that each member of parliament got, in my own case, I've been trying to upload from last week, and I've only uploaded 20. Only 20.
Okay.
And it just keeps rejecting, and you try it over and over again. It gives you a different reading on why it is being rejected. So there's something wrong with the system, and I'm happy to hear that it is extended.
Okay. Okay.
But there's still something wrong with the system that it at different times it rejects. But there are also students who, in the case now in high school, I don't know if it is that they got the student registration number when they got to high school. There was one case I had to call a principal yesterday for a primary school, where students that are now in high school went to this primary school to get the student registration number. The case is that they didn't have one when they were at the primary school. I don't know for what reason. In high school now. And then when they finally got the student registration number, it is giving them a different school. So there are some instances that rejections are being made because of some glitch somewhere. But it has to be looked at, because the parents, the TRN number, in some instances, just not matching up. And hence why, at this point in time, you only have this amount of application, 14,000 done, which is 1 day before the deadline is due. So I would just urge the ministry to talk to eGov and see what is happening in that instance.
Right. So, Chairman, just to say, sir, and we are noting the comments for follow-up. The registration number is unique as best as the system allows, and it's one number that is provided for each student once you enter at grade 1, and it takes you through the system. The tax administration, they are also a part of the system where the TRN and so on are actually verified. Of course, the back office, so they also facilitate, but we will put the comments forward, sir, and see if there is any further support that the eGov team can
When
can
the
provide.
COVID grants were being done through the Ministry of Finance, there was that issue too,
Yes,
with the
yes,
TRN. So,
yes, sir.
and I know eGov had some part to play with that also. So that's what I'm saying, just see what are some of the weaknesses that happen in that program, and how it can be strengthened in this program too, because we have been getting more and more requests, more than the forms that we have gotten for the assistance.
Okay, sir. Noted for our follow-up.
Thank you very much, Mr. Chairman. Through you to Madam PS. We do understand the need for timing for people to get within the system within a certain time.
This is a follow-up on the same thing here, Member Clark? But the member would have to yield. Member Hamilton. Member Hamilton, continue. You'll allow the follow-up, all right.
Thank you. With regards to the concern that the chairman raised, what if the situation do exist at the end where the student registration number and the TRN number still give a particular child a challenge. Will there be some sort of accommodation for that child due to no fault of the child, because the system, something about the system keep rejecting the child? Will the ministry entertain some sort of waiver or alternative arrangement, having investigated that situation?
Yes, member. Once it is brought to our attention, we will do the investigation, and if there is actually a glitch that is no fault of the parent who is entering the information, then we will actually support. One of the things that our minister also said is that for those of our members of parliament who received the application forms, you can just make a note on the application form, and we will, once they are sent back to us at the address that we have provided, we will go through, do the checks, and we'll also do the verification accordingly and provide the benefit once the person do qualify.
PS, going to the rubric.
Yes, member.
I noticed that there are a number of indicators that have been identified for the student and for the parent. Now, under the student, it makes mention of a welfare program that the child would have benefited from through the school. I would just like to know the types of welfare programs that exist and why a child would be put at a disadvantage for benefiting from same. And I use the term disadvantage because the child is marked down if that child benefits from welfare.
Okay, so member, there are many different programs that do exist within our schools. There are some students who are on scholarships based on specific requests for NGOs or individuals who want to contribute to some schools. There are also cases where the schools have identified some students who are not on path, usually classified as the vulnerable poor. They may have fallen into circumstances somewhere along the line and are not on path. And so the school has these students on a particular program. Funds provided, we would have sent out the directive that they could use 10% of the grants that we provide them with and other funding within the school to support welfare of those students who are not on path. So those are the programs that we are actually speaking about. And of course, that is why the points are how they are actually done there.
So you mentioned that those students would not have been on path. This program is for students who are not on path.
Not on path, right.
But then the students who benefit from welfare are pretty much graded down then in relation to their eligibility for accessing a tablet.
Because there is some amount of assistance that the student may have already been receiving, but also just to say that the scores, the overall scores based on the system, which is what would determine whether or not the child has met the criteria. So I take the point, member. I will discuss it again with our minister in terms of that specific area, and we can be guided accordingly, except that we already have 13,000 applications that have met the criteria based on the scoring rubric. So it may be a little difficult to change at this time. Just to indicate too that in the system there is a verification that the principals of the schools also have to do. And so based on what they input when the information goes to them will actually verify that the student is really being supported or is not being supported, because it's really a moving target, because students are not permanently on a welfare program. It could be for a specific year or a specific set of months. So that is why the principal's verification, and they know their students very well, become very important as a part of the selection criteria.
But what the selection process is done via the application,
Yes, member.
which would mean that the human intervention would not be a part of it upfront. So there are quite a few students from your report that would not have met the eligibility criteria and could possibly have been because of one or two of these indicators. Because what I also see here is outside of students who benefit from welfare, there's also another indicator for students who are on scholarship. So it is separated. So they're marked down twice then for having any one of those as being applicable. But further, when you go to the parent information, under the employment status, it speaks to parents who earn less than $25,000 a month. And it also speaks to the income, the monthly income. To me, that is almost duplication of a criteria, because you ask it once in the employment status and then you ask it again under the monthly income. So I'm not sure why this is so, or what the mischief that is being mitigated.
Well, member, I believe we tried as best as possible to develop the rubric to make sure that we are supporting the neediest of the needy. And so it may appear, well, now that we are looking back at it, because it is new and it's work in progress, so we can always look back at it going forward, but we really wanted to make sure that it is the neediest of the needy that benefit from this support. Nevertheless, we are interrogating the data, member, the 1,079 who did not meet and the 24 for consideration. We will actually get the analytics from eGov and we will review to see what specifically would have happened. And of course, if these cases are eligible cases based on any issues with the system, then we will support accordingly. After we have done the analysis, then there perhaps may be the need for us to look back at the income level as well, but that is really for a decision from our minister. So again, I will note, and we will look at the rubric for both the parents in terms of the income as well as the welfare, as you have indicated.
Pierre, you mentioned 1,079 that have not met the criteria. And on page 41, it speaks to grade level and it disaggregates the numbers for each level. But then at the top, it has 796 as null. Those persons who have not been identified or placed in a particular grade, have those persons been automatically disqualified, or they're part of the 1,079? Page 41.
Okay, so the report I was actually reading from is actually an update as of today's date. I thought it would have been important. This one would have been from last week. But you're talking about where we have the top 10 schools, that column?
Where you have grade level, and it speaks to null, 796 persons.
Right.
They have not been identified for a grade. So I'm not sure if that has disqualified that number.
So yes, that number is actually a part of those persons who would not have met the criteria, that we will have to do some further interrogation. So if we look at the 1,079, right, so those are the numbers that we will have to interrogate a little more, member, to provide more details. It would have indicated that this number, they would not have been able to identify specifically at the preparation of this report exactly the grade level that these persons are actually from. So I'll have to get some further details and provide the clarification on that for you.
That's it. Member Hanno.
Good morning, PS. Good morning, members from the Ministry of Education. PS, at a previous sitting with you and I, we've always lamented about certainly the grade 4 students who would do the literacy test and then not perform as satisfactorily as we wanted to. And I remember in one particular sitting in the PAC, you said to me that because we didn't have the spaces in the schools to keep them, we had to push them on regardless. You remember that conversation?
Member, not to push them on regardless, but to have them advance to the next grade level and for the intervention to take place based on the weaknesses in the higher grade level.
Well, that is a position I'd like to start with.
Okay.
Because the thing that concerns me most with COVID and the tablets and all the other things are the remedies that we now have to find in quick succession. So when I read through the various reports, what concerns me is that if we have 450,000 students in school and your data says that only 85,000 of them are actually accessing the 4 different points, and of that 85,000, it even comes down further, who are enrolled at a particular time. And then your data goes forward to say that when you did the grade 4 literacy test, the majority of the students this year only got a little over 50%, but less than 75%. And then at the grade 6 level, they got 50%. And then you go further to say that you are putting remedial things in place, but the remedial things don't speak to the primary school children. It speaks to the CXC students, and it speaks to those who are doing remedial English and mathematics. So the questions that I have for you are, 1, is it still the case that 50% of our students in schools at the moment are on the PATH program? 2, if the students at the grade 4 and the grade 6 levels are performing only at a satisfactory rate, given the fact that many of them cannot access the online and other exigencies, what really are the remedial steps that we're going to take to make sure that they can go forward and they don't lose a passion, or that there is not any lost learning, as you've said in the report, because you do say, and I quote, it therefore appears that there is a significant learning loss due to disruption caused by COVID-19. How are we going to rectify that against a background that already exists in education, where when the students get to high school, even pre-COVID, they were not performing in some instances, and we still could not, and I say we still could not find the remedies at that point to satisfy those things. So how are we now? Because even when as members of parliament we're trying to now assist with the tablets, and those adjustments are not happening quickly. So if we couldn't fix it before, please tell me how we're going to fix it now.
Well, Member, I take the point that you have made regarding the actual performance of the system prior to, and you're correct. The primary exit profile that was implemented last year would have shown that it's approximately 50% of our students who actually met the criteria to advance. So it means that the other 50% would have needed some support. Now, prior to COVID, the ministry introduced the alternative pathway for secondary level education, which is really the advanced stage of the program that we had that we called A-STEP, which was actually being supported from the grade 4, where once we have identified the gaps, then there would have been the support from the literacy and numeracy specialists. Now, what happens with the apps, as we call it, is that the students, based on their PEP results, would have been identified in 3 pathways. Pathway 1, which is the normal pathway, meaning that they have met the criteria.
Yes, I'm going to stop you 1 second, because what you had said earlier was that when they did the PEP exit tests last year, 50% of them had only qualified to go forward. So we agree that there are issues that have to be addressed. My substantive question was whether or not, given those realities pre-COVID, so you have implemented those other things, but if your data that is here is saying that perhaps less than 34% of the school's population currently are not accessing even the learning that the ministry is putting in place, what you're saying to me is that with everything that you've written, with the tablets and all these other things, we're going to have serious problems in the students, not only at the grade 4 and grade 6 levels, but even students across the high school. And I think we need to spend some time. I'm really looking at what is going to happen to the fabric of education in this country. That is a concern, and I don't think I'm getting the answer.
Right. So member, I was just trying to explain the program that we have in place with the 3 pathways, which really is being implemented, well, it has been from 2015, actually at the high school level, and so targeted attention is being provided for those of our students. And while we had 17,000 tablets before COVID in the system, was as a result of the fact that we had started to provide the support and student support coaches to work with those students. So, member,
but PS,
I fast forward now
PS,
to...
if from 2015 you have implemented these programs, and in 2019 you are saying that still 50% of the students who did PEP just qualified satisfactorily, and this is pre-COVID, you don't see a red flag?
So, Chairman, I take the point that education within its entirety is an area that we have to continuously work on to see how we can improve the performance of our students. Of course, there are many variables that impact their performance, and I can assure you that we have analyzed the data in great detail, and we are working towards putting the interventions in place. Your substantive question that you indicated, Chairman, having to do with how are we going to be addressing the learning loss of the students based on COVID. And on page 23 of the report, we actually outlined a program that is going to be implemented in December here for maths and English with our literacy and numeracy specialists, to really try to see how we can engage these students in small groups face-to-face, using the technology where it is possible, and really to support these students. Outside of this intervention, the curriculum team is working on a more detailed intervention, which will also cut across the other subject areas. So yes, it is a double whammy. We have the learning loss before, we have the learning loss now, but the important thing is that we have the data, and we are committed to working with the team and our other stakeholders to try to see how best we can improve the performance of our children.
I want to give the opportunity to some of the other members who are here to follow up with some questions.
Member, and then you can.
Yeah. Thank you, Mr. Chairman. It's just a follow-up on Member Anna's point, and you started to respond to it in your... I share my colleagues' concern about these low performance levels that we have been seeing, and you refer back to 2015. And the question I have, that emanates from my concern, is that we know we have these low performance amongst a good amount of our students at the grade 4 level. My concern is the level, and grade 6, the level of intervention and the focus on the intervention to give the desired results. Because quite often we put a program in place and we take comfort in the fact that we have put a program in place, but are we getting the results that we need, not even that we want, that we need? Huh? So it's kind of an ongoing situation, right? Because in my own constituency, for example, the tablets, most of my part students are not getting any. Most of the other students, when I check with my high schools, there are 50% of them not on it. And I tell you, when I inquire about those who have tablets, how many of them are logging on? It's probably another 50% of that. So about 75% of the student population through those schools are experiencing no participation at all. So you're going to have a school term that is in great part a school term on paper, but not a school term where students are actively engaged. That for me is where the crisis is.
Yes. So Member Jackson, I share your concern, sir, and I can't sit here and pretend that it is an easy task to look at all parameters and all areas, including where our students access from, the intermittent access that they have, and so on. So it is really a challenge as we speak, but I believe that based on the data that we have, we are not prepared to just see it as a crisis, but we are prepared to chip away one step at a time to see how best we can address the learning loss. And so we currently have 100 numeracy specialists, for example. Literacy, we have about 15. Those specialists are persons who worked with the specialists that have been employed within our schools as literacy specialists and numeracy specialists to support our students. We decide that we will start with maths and English, because we are of the opinion that once you have developed the principles in those areas, then it is easier for you to learn the other areas. So we understand the situation. The team at the ministry is committed to working with all stakeholders. Education gets a lot of support from our members of parliament and from other persons who are just volunteers, and we just have to find a way to engage the students as best as possible. We have had discussion with the Universal Service Fund, for example, and they will assist us in utilizing their community access points to engage 5 or so students at a time, which is what the intervention here speaks to. The ministry is willing to provide the teachers to go into the communities, to meet with the students, to work through with them as best as possible, and also our churches are coming on board to make their facilities available as best as possible, where we can physically engage some of the students who are not being engaged at all. So we are very concerned about the engagement level, but we are willing to push forward as best as possible, sir, to ensure that we cover some grounds in improving the quality of education for these of our children.
Member Henry.
Other small, I just ask it now. Regarding the eGov role in the procurement, there's a perennial question that I raised with you at a previous meeting. Because when I hear even the Prime Minister speaks, well, bemoan the fact of so many students that are without tablets and how many are being procured and to come into the country mean they are not. And I know, and you know to PS, there are thousands of those tablets that meet the criteria that for some bureaucratic reasons are not being utilized while thousands of students are without tablets. My question is, the procurement exercise is exclusively of eGov, and how long does it take in eGov to process the application for qualification in supplying the tablets? I know of one case where over 3 weeks now, one supplier has applied and is yet to get any response from eGov.
Okay, so Chairman, I believe you are talking about e-learning, sir. E-learning, sir. Right. So, not Chairman, member. So, sir, as you know, I am not able to speak about the tablets that are not within the system, as e-learning is actually a part of the MSET ministry and not education. So that question would be best answered by them as it relates to those tablets. I will say, however, that we have the procurement, for example, of the tablets for the secondary level. We have seen where within a 6 weeks period, e-learning was able to have a contract in place for those tablets to be procured, and we expect delivery by the end of December into January. So I believe they have improved their system significantly as it relates to the procurement, and they are really supporting us at the ministry really very well in terms of ensuring that the tablets, when they come, they are prepared and they are distributed with the requisite accountability systems in place to our teachers and students, sir.
Let me just on that one. In the supplementary budget, there was a $1 billion to the Ministry of Education.
Right.
For this same project,
yes,
of the laptops.
Right, yes, sir.
The minister herself said that a contract for $1.23 billion was attributed to one supplier for the 15,000 laptops.
Yes, sir.
Did this go to tender, or was it a follow-up, or did it go through emergency procurement? What was the process for the purchase of these laptops?
Okay, so, and I want to make sure that I give you the right information. I know that I think it may have gone through emergency procurement. Philippa, you can correct me if I am wrong. It went through sorry, I am being told that it is single source that was used. It went to the Public Procurement Commission, and it was approved there, and it went to Cabinet and was also approved.
And why I ask the question? Because even in the first supply of the tablets that was procured by the ministry through different sources, e-learning and others, it was mentioned that there's a shortage, and the minister said it in the House, that there's a shortage of the devices worldwide.
Yes,
so, and I find that ministries and ministers tend to come here and use that NCC signed it off, but never, but yet still we find hiccups along the way. And why I'm zoning in on this, because how is it that we have shown that this supplier, the single source supplier, can provide 15,000 laptops when there is a shortage worldwide? And what are the consequences if they are not supplied by the end of December, early January, as you have stated?
So Chairman, I'm respectfully asking, sir, if I could get that information from e-learning and have it submitted. The procurement process was handled entirely by them. We at the ministry, once we agreed, we sent them a letter and got the support for them to go ahead with the procurement. I would not want to speak out of turn since they are within a different ministry as it relates to the process. I am really hoping that the tablets will be delivered as we have been told, and the consequences from a contractual arrangement would have to be explained by the company if the tablets are not delivered. So.
I would love that response from you, because you're talking about $1.23 billion. You had about 4 or 5 suppliers in the first instances for that 33,000 that was supplied. The tablets that were supplied, there were challenges in even these suppliers getting these 33,000. So to have one supplier that is going to supply 15,000 tablets in a shorter space of time would raise a red flag for me.
Okay.
Yeah? So even though it is done by sole sourcing, what are the criteria that this one contractor, not multiple contractors, being able to source it worldwide? Because it is a fact that there is a shortage. Because Jamaica is not the only place that is trying to procure tablets or laptops right now. And a 15,000 order is a small order which will drop you down the chain, which is what most of the suppliers are saying. Because you have other countries who are ordering like 100,000, 200,000 laptops and tablets, which will be more priority for the suppliers. So I would love to know what are the criteria why one supplier got a contract as sole source for $1.23 billion to supply these tablets. As you said, the contract was wrapped up in 6 weeks. And I understand the urgency, but why one supplier? And what is the criteria for this supplier that makes him different from the others?
Right. So, Chairman, I've made a note of it, sir, and we'll ensure that information is provided.
Sure. Mr. Henriquez, and then yourself after.
Thank you, Mr. Chairman. PS is a little... Huh? Sorry? Yes. I just want to just go into support Member Hannah for a moment and make a separate comment in that I'm very concerned about the capacity of dealing with the amount of students who are not in school presently, and that we need intervention going forward, how that is going to be handled, because there are quite a lot of them. And I don't see from the report very specific way that is going to be handled, whether online as well, because there's thousands and thousands. How are they going to be dealt with if they're not online now? How are we going to engage them after? Or is it going to be a face-to-face type of engagement? And how is that going to work? Because it's over 50% of the students who would need to be dealt with at that point. But also, I want to ask a question about grades 1 to 3. Now, that early childhood, part of the early childhood is very important, and I've heard nothing really about what's going on in that area. Are there no tablets for those children between 1 and 3? How are they being engaged on a day-to-day basis? As some information, if you could. And so the third part of this thing is that if the tablets are taking so long to arrive, especially in grades 7 to 9 and over, the classes are still being carried out now, and they can't get on. So how is that, if they arrive in January, February, March, do they become a major problem? How is that going to be dealt with? So, but primarily I'd like to understand about the 1 to 3, grades 1 to 3 situation.
Okay, so member, there are 3 approaches that we have indicated to the system to support education during this pandemic. The accessing virtually is one of the approaches that we have indicated. The other approach is the use of audiovisual. And when we say audiovisual, we're talking about television and radio. We have secured for at least 4 hours per day on TVJ, main channel, where students are able to access the lessons. We also have that on CVM, in partnership with Ready TV in the afternoon for another 4 hours. We also have almost all day, except for when the PBCJ has to be covering meetings such as this one. They have programs that they are airing. We also have the eHome network that goes all day. And we also have a dedicated internet channel for maths that is currently on One Spot Media. And we have about 6 radio stations that we have contractual arrangements with that do provide lessons based on the curriculum. In addition, sir, we have partnered with the Gleaner and the Observer. We prepare what we call learning kits. These are distributed to the schools and to students. And each week, we package the kits based on the lessons, and we send these out as best as possible. And teachers actually go into communities, engage the students in small numbers to ensure that at least some amount of work is currently being done. We would have loved to know that all our students are able to access virtually. But until there is adequate internet access across the country and the instruments are provided, then that is a work in progress. And in the report, as I indicated before, sir, we have outlined just a simple intervention for maths and English that, as I indicated, is to start in November, and this is where our teachers that we are going to engage will be going into the communities to also engage the students as well. And over the Christmas break, we will now finalize the larger intervention plan for the support of our students. We are, as I indicated before, member, very concerned about the number of students that are not engaged, and they are the ones that we are going to be targeting. Now, tablets will also be provided to our grade 1 to 3 students. They are in a better position at early childhood and grade 1 to 3 because of the level at which they are at. For one, at early childhood, up to age 5, the research has shown that their screen time should be no more than 15 minutes at a time for every 2 hours or so. So the plan there is to provide tablets in batches that the teachers can actually utilize with them. For grades 1 to 3, the ministry provides the integrated studies workbooks and textbooks, so the content and the workbook at that level, those are together. And we have distributed to all our grade 1 to 3 students, whether they are on path or not, so that they can actually be doing some practice at home until their tablets are provided. Just to also remind us that I mentioned earlier the face-to-face in the 17 pilot schools, and we are now working with the Ministry of Health with another 109 schools, and I think about 103 of the schools that they have inspected already have shown that they are satisfactory. And so my team is now working with those schools for them to commence the phased face-to-face opening. And so gradually, as we track the COVID cases through the Ministry of Health and we are guided, we will see more of our students to be coming in face-to-face for engagement, as it has shown that the schoolroom is actually the best place for our students to be engaged based on the wide and varied other socially related and other issues that they have to contend with within their communities, sir.
Chairman, sorry, I know there's a lot of people waiting to ask questions, but if the pilot operation schools now are experiencing such a low attendance rate, when you transition more to this pilot and widen it out, what is there to say that your attendance is going to be increased? And what I'm seeing is that there is a low attendance even in the pilot school program. You have the majority of students still to get to of losing the year, and if the resources or the capacity is not there to deal with them now, how is it going to be there to deal with them later on? So I'm just having a little clarification maybe or understanding of how that's going to be addressed.
Right. So member, the attendance rate based on the evaluation may have seemed low, but it was out of an abundance of caution of the schools introducing the blended approach that we had worked out with them during the summer when we thought school was going to be open in September, which meant that it's only a component of the population would be on the school compound at a particular time. Also, the pilot was new. It came at a time when some of our parents were not fully ready in terms of the preparation of the students as well. And so we are optimistic, sir, that as we move into preparing the schools, it's going to get a little better. So for example, we have already met with the 109 schools that the Ministry of Health had indicated that can be considered, and we have briefed the principals. We have asked them to consult their parents and the other stakeholders on the ground, and they are expected to be submitting their readiness matrix to our Chief Education Officer today, so we can assess and make a decision as to when those schools will start the phased reopening. And I really would just want to ask all Jamaicans, and especially of our members of parliament, just to encourage our students and the parents to try as best as possible to access the opportunities, while we try as best as possible to make available the resources that are needed to support their education.
Members, we have 4 other members who want to ask questions, but we have to remember also, please be pointed, because we have another ministry waiting, and the time is soon midday. All right. Member Witter.
Thank you, Mr. Chairman. My question is just a follow-up to your observation, Mr. Chairman, with regards to the contractor that is being engaged now for the tablets. Is it that contractor was a part of amongst the 5 who were engaged prior to this arrangement?
I'm sorry, member, I was a little distracted. I'm very sorry. If you could just repeat the question.
Yes,
please,
the chairman was asking the question about the contractor, the supplier that is being engaged now for the tablets, and the challenges that you face with the first set of arrangement with the 5 contractors. Is it that this contractor that is being engaged now, was he a part amongst the 5 who did the first?
Okay. I'm not able to say at this time, sir. I'll have to verify that information.
Okay.
Simply, Member Witter, because the procurement was handled through e-learning. The 40,000 was a part of the initial tablet in school program that started in 2013. So they also handle that exclusively, but that we can check and provide the information, sir.
Good.
Member Clark.
Thank you very much, Mr. Chairman. Whilst we are all deliberating and adding our comments and recommendation as it relates to the distribution of the tablets and laptops, what I would seek, though, Mr. Chairman, through the committee here, is for Madam PS to at least lobby with the ministry that has responsibility for the Wi-Fi to have more community Wi-Fi sites, because we do understand that the individual Wi-Fi internet service, we're not having it as it should, and if we want, for a community such as Canterbury, you really want to have a community Wi-Fi site.
All right.
So we hope that we will seek the necessary moves from the different ministries to accommodate that situation. But Mr. Chairman, quickly, you know, economics is all about demand and supply. And if I heard you ask a question of the permanent secretary, but my remark to that, Mr. Chairman, is that once the sole source, as you made mention, once it is a guarantee that, yes, you're going to get the work done, then going to a company or a manufacturer to produce that amount that which you want is easy feat, as long as there's a guarantee.
Well, my interest in it and why I had brought it up is knowing the difficulties of being able to procure worldwide from manufacturers. That's one. And two, we tend to go that route whenever we have an emergency. And then the supplier, when not able to supply, then it is the taxpayers that is left holding the bag. My interest is what then if the supplier is not able to supply them within the space of time, being a sole source. That's all my interest is. Yeah? So,
once again, Mr. Chairman, it's all about demand and supply.
We'll
the
see.
fact of the matter is that we are engaging ourselves with 36,000, and we still have a problem with people registering on. So I suspect, just as though the registration is taken in time, piece by piece, sector by sector, I suspect that the supply will be in the same.
we'll see. Yeah. Member Brown and then Member Hamilton.
Thank you, Mr. Chairman. Madam Pierce, I'm happy to hear about the specialist, because sometimes people forget that the tablet is just a tool. The children will still need human support from the teachers and parents alike. My question is, will the application process for the tablets for those persons not on part exclude parents who cannot read or who are not familiar with how the device is used on the online platform?
Oh, Lord, I didn't hear clearly, sir.
Go again, because we're
All
we're
right,
not here.
Mr. Chairman, sorry about that. Pierce, I'm happy to hear about the specialists, because sometimes people forget that the tablet is just a tool. The children will still need that human support through the assistance of the teachers and the parents. The question is, will the application process for the tablets for those persons not on part exclude parents who cannot read or who is not familiar with how to use the online platform?
Okay. So, Member Brown, it will not exclude parents who cannot read once we are provided with the information. The reason we provided the application forms, once it is completed and you submit them to us, then we will actually facilitate the process of applying for those persons and to receive the voucher on their behalf and to ensure that it is provided to the parents. So what I will say, if there are difficulties that persons are having, we are willing to try as best as possible to facilitate that process. Even if they can't read, however, then the form still would have to be completed with the information, or we have a discussion with them and have the form completed and they place an X and we have the information uploaded. So we are really trying not to exclude anyone at all, sir.
All right. Member Hamilton, Member Hannah would just like a little follow-up on that. Okay, go ahead.
Yes, the diagnostic assessment test that was given to grades 4 and 6.
Yes, Member.
Your result or the report is that a majority of students received, and this is for the grade 4 assessment, greater than 50% but less than 75% in all subjects.
Right.
And it is the same wording that was given for the grade 6, majority of students. Is there an actual figure that we can get in relation to what this majority is? Is it closer to 50%? Is it above 70%? What is that figure?
Right, so
that we can relate to how well the students are doing.
So, member, the full report is not yet ready, but if this will help, we actually did a sampling of what we would have received so far, and I only, at this point, can provide you with the mean scores for the different areas. So for grade 6, I had indicated that for mathematics, the mean score is 23, for language arts is 30, for social studies
I got those, PS. I don't really want you to go back through that. I wanted to know the figures in terms of the students now.
Okay.
So how many of the students would have received this? Well, it would appear to be failing grades.
Right. So, Member Hamilton, we need a little more time to
All right,
put
not
the
a
full
problem.
report together.
But that number, based on your, because you have now a mobile intervention program that you want to implement based on your diagnostic assessment. The report or the program seeks to target 8,400 students, both from the primary and secondary. Am I correct?
Right, in the first instance.
But based on your on page 25, you speak to 5 students per teaching group. So there's a disparity there in the numbers, because if you have 3 teaching groups and 5 students each, and then there's the spin-off question as to who will choose these 5 based on the numbers that you may have per grade. But you have 5 students per teaching grade, you have 3 teaching grades, and you have 40 locations per region. It would give us a figure of 4,200 and not the 8,400 that you're targeting. So I'm not sure if you're doing it on a phased basis. Right. You may do 4,200 now, and then another 4,200 after a later date. I'm not sure how it will be implemented, because based on your implementation plan, it says that it should start in January for 5 months. Have you already started this program?
So there is actually a process in terms of the identification and selection of the PERSIS member, and I know we can all understand the logistics in terms of getting it done. So we wanted to do it in phases. When the report was initially prepared, we had indicated that we could start officially in January, but I have said to the team, let us pull back, because we have an opportunity during the Christmas break, of course, practicing the protocols from the Ministry of Health, to start supporting those children, because the learning loss is quite grave. So that is why I've asked to pull back. Now, in terms of the selection, member, the principals will have to support us in that regard. So we will first and foremost look at those who are being engaged, look at the communities that they are in, look at how easy it is to communicate with the parents and to get them at the area that we are going to be providing the support. So the numbers may go up, they may come down, but our aim is to ensure that we target as many of our students as possible during this period. And this is going to be a part of a much larger intervention plan, but we realize that we really can't wait until when the ideal condition to start meeting the learning loss. So we really have to start now.
I agree with that, PS, entirely. But what I wanted to get was the fact that the 5 students per cohort would be wholly insufficient. So I'm foreseeing where you will have a definite increase in the numbers. And then that now speaks to the capacity, and it also speaks to the finances to support what you want to do. But it is necessary. So I'm not sure if you have addressed your mind to how you will overcome this challenge that will come.
Remember, there are lots of factors in place, including the perceived notion of setting up a school in a school. We know that students are already enrolled in specific schools, and we do not want to duplicate the process, the formal process that exists. And so that is why it is the parents, not the parents, the teachers who will identify the students with the team that we have selected. Also, we do not want to run in a situation where if we are having these persons in one of the community access points lab, then we now have to set up an isolation area if there are, in the event that there is a case that has to be dealt with and other matters. And we don't want to get ourselves in a situation where we can't ensure that all the protocols are enforced. And so we carefully selected 5 to start with. Even if we have them at different points during the day, I think we had said it would be between 1 and 5 in the proposal. We may decided to have different groups at different points, but we are really trying not to get into another logistical challenge as it relates to the not being able to observe the protocols from the Ministry of Health. But as we implement, member, and we evaluate, if we find there is a more effective way to do it, then we will ensure that we do so.
Yeah, that's it.
Just one other question. It's really to get some clarity on your school attendance report on page 14.
Page 14.
You refer to 3, 4, I think 5, about 6 weeks reporting, but going through the numbers, you identified a number of teachers on staff, and you identified teachers with comorbidities. I wanted to know whether or not the figure for comorbidities is a subset of the on-staff figure, or if it is a separate figure altogether for the teachers. That's one.
Okay.
And 2, you identified those teachers who were working from home and those who were working from school, but the figures that you have working from home and from school don't always accord with the total on staff. So I just want to know, what the issue, what the discrepancy is, and why it is so.
Right. So, member, the number that we have on staff would be what we have on our statistical data, Vivian, as it relates to the number of teachers in those schools according to region. So that's that figure that we have there. Those with comorbidities would be what the schools have actually sent in to us to say that these teachers have indicated. Of course, there are persons with comorbidities who really do not say, but as best as they can identify, these would be the number of teachers.
And that number is a subset of the total on staff?
Right, so that number would be a part of the total on staff. But those who are working from home is done differently, because you may be working from home because you have comorbidities, but you may be working from home because that's the ideal place for you to be able to do the virtual sessions or so with the students and based on the communities and so on. So while those with comorbidities would be included with those working from home, it's not really a separate number.
No, I get that, but for example, if you look on page 14, for the first week of school at Region 3, you will see we're 2,144 teachers reported in that region. Working from home, it was 1,707, and working from school, it was 577. Now, when you add those two figures, you get a greater figure than what the total teaching cohort or complement is, because there's a positive variance of 140. So I wanted to know whether or not this overage was deliberate. Have new or additional persons been engaged? That why we're seeing this figure?
Okay, so it's a little difficult for us to, the figures, I would say at this point, member, it's very difficult for them to balance as we would have wanted 100% because of the dynamics. Certainly in week one, when we just started, and we may see it in other weeks as well, there could be other teachers that have been added that really would not have been picked up yet in the statistics that we have at the ministry as those who are on staff. So there may be a plus or minus, or there may be a variance in terms of how the figures are broken down, because we actually get the figures, the on-the-ground figures, directly from the schools, and those are tallied. I know that this is not perhaps the best way to do it, but until we have our full school management system that can provide us with the real-time data, then we will not be able to have the numbers as specific as we would have wanted it. So in that number, member, there could be teachers who would have been recruited to assist, whether it's on a part-time basis based on what is happening in the school at a particular time, and would have gotten permission from the ministry to do so.
Is it possible for us to get further information on it?
Yes, yes, yes. We can. We actually have the spreadsheets that the Google Sheets that the information would have come in, and that detail can be provided.
Right, because I do recognize that for each week, the additional staff that you would have gained have been registered in each week. So if 8 additional persons came on, it is here, but then there's still this variance now when it comes on to the working from home and working from school. So
Okay.
if we can get further information on it, I would be grateful.
Okay, member, we'll provide the additional information.
Member Hannah.
Yes, I want to make 2 suggestions, if possible. For some of us sitting on this committee and other committees, we would have been exposed to a lot of the information or the cycles of information that has been proffered. I think we're all living in very, very different times. And perhaps 10 years ago, where you would have had an army that invaded a country, right now you just need a virus or a mosquito. And so all of us have to change accordingly. The concern I have is that when we look at education, national security, and even health, they get the bulk of our budgets. And I feel that coming to the twilight of my political years, which would have been nearly 20 years at the end of this term, I sometimes feel that we're standing in our own way of progress. And during COVID, I find that many of us, including yourselves, are approaching the problems with the same solutions that are 10 years behind 10 years ago. In other words, it's not a fault of yours that the institutional memory of education probably approaches a problem. And I think education right now is the single greatest thing that we can do for this country to help us leapfrog forward and even help us to pivot the base of our economy, that if we get into another COVID spiral or any other kind of virus, we'll proceed. So I want to put 2 suggestions on the table.
Okay.
Tourism not keep anytime soon. Or if it is, certainly the marketing budgets of tourism. And I know ministers in particular hold on to their turf. But I think in this special period that we're all in, the government needs to consider how best are the various ministries going to come together to ensure that this generation of students, which is the Generation Alpha, Generation Z is gone, the millennials are gone, and apparently this generation is supposed to be the most transformative one. How can tourism reconfigure some of their budgets? The Ministry of Culture, because I doubt festival. Carnival is not keeping in Trinidad. Mardi Gras is not keeping in New Orleans. And I doubt festival and big events are going to be kept. So there are pools of resources that I'm sure can be marshaled, that you can put the community access points very, very, very quickly and perhaps use other mechanisms, including entertainers if they need work or other kinds of mechanisms. You can think about it, but it can't be that you're working in a silo without the other ministries and their inputs at this point. The other suggestion that I have for you is how are you going to utilize the low Earth satellite stations that are there? The United Nations is doing it in other countries to make sure that in countries that are poorer, with large populations, that they set up and they give assistance using their space committees and working with other countries to be able to utilize those satellites. And all I'm saying to you, PS, is let us not stand in our own way. I know you're trying, but it's too slow. And by next year, March, it will be 1 year that students will not be at school. And I'm sure March is going to come and catch us back here at this committee with us talking about the same issues about tablets, about procurement, and about other things. And we can ask those questions. All of us can ask them. We can deliberate. We can say it's 1 billion, etc. But at the end of the day, you're going to have those grade 1 to 3 and those other students who are going to be behind. And we will all have to take responsibility for it.
Yes. Thank you for those suggestions, member. I'll discuss them with my minister so that she can have discussion with her colleagues for that to be considered favorably, member.
Just one question I have and we can wrap up. For the pilot projects, the pilot schools,
Yes.
the 17,
Yes.
because looking at the supplementary budget, there was no real additional amounts to the
Right.
ministry itself outside of the $1 billion for the tablets or
Right.
the laptops.
Yes,
The own your own devices. From your report, 509 would come out of the budget of the ministry.
Right.
What are the other additional costs that is being borne by the ministry? And how is it that the funding then is being diverted? What are the programs that is being diverted for these additional? Because these were not on the original budget.
Okay.
That was passed in earlier this year.
Right.
So how is the ministry managing? What is the additional cost for setting up those schools? I'm sure additional funds would have had gone to these 17 schools to set up isolation areas, the sanitization, chemicals, additional staff. And I see where you have another 109 schools that are that's been basically approved as low-risk schools and compliant by the ministry. What will that cost to get these schools up to the stage of opening come January?
Okay, so Chairman, first let me say that there are some costs that would not have been incurred because of the pandemic. And we have a budget of, I think it's about 5 billion, Mrs. Banton, for regular grant tuition. Yes. We have a budget of about 5 billion for regular grants, which would be those grants that we send to our schools, the high schools and the primary schools. So we were able to ask the schools to utilize those funds that they would not have been using because the students are not at school. To take care of these areas that they needed to put in place. We also recasted the budget based on the amount of money that we have for goods and services, and we actually made an allocation, Mrs. Banton here, in terms of the specific areas. So we were able to identify, I would want to say perhaps about 2 billion or thereabout to take care of the key areas, which would be teachers and support staff, infrastructure, teacher training, sanitization, as well as ICT support. So we comb through and areas that we would have provided the schools with. So for example, Chairman, we would have provided the schools with an internet grant. Instead of providing them with that internet grant, we negotiated directly with the telecommunication providers and Ready TV to utilize what we would have otherwise sent to them to do those procurements. So that's the approach that we have utilized, and with, of course, the permission from the Ministry of Finance to ensure that we are supporting the schools. Now, for the 109 that we are currently working with, once they send in their matrix, if there are additional things that they require, then we will look through to see how we can provide for them. But based on what we did in July, August, and based on the grants that they received, they were able to absorb, except for the new teachers which we are providing, they were able to absorb the operational cost. From the pilot, we have realized that things like hand towel, for example, is being used rapidly. So we will now have to go back through with Mrs. Banton to see how we can provide greater support in that area, both hand towels and sanitizers to support the schools. Now, the isolation area, the schools have been very creative and the Ministry of Health has supported. So in a lot of cases, they have been able to use a room that is close to a bathroom for that purpose. One or two of the schools actually had to utilize a tent and a portable, the portable toilets that we see used from time to time until they are able to put something else more permanent in place. And the cost for those portable toilets is borne by the school or the ministry? No, the schools are the ones who do the procurement based on their operational grants. So we centralize a few things, sir, which would be the teachers, which would be the ICT support, but all the other operational activities, they take care of those out of the grants that would have been provided. Okay, so that means the ministry is being able to manage so far. Well, we are trying our best to manage under the circumstances, sir. The suggestion Member Hannah made is an exciting one, so we will see. We will see how that goes. Chairman, just to say earlier, I had mentioned a number of 20,000 tablets to be procured for grade 7 to 9, but I actually made an error. It's actually 16,000 and not 20,000, sir. Grade 7 to 9. Right. That's tablets to be procured. Right, tablets that are going through the procurement process, sir, for the grade 7 to 9 students. Okay. Thank you, Madam Pierce, and your team. I think we have gone through that report, and we'll continue following to see how best we can support the job that you're doing to enhance education. Thank you too, sir, and to your members as well. All right.
Mr. Chairman, before health, you're going to start health now? Is health moving up or they're staying there?
Well, the PS to just adjust. Oh, all right, no problem. Gotcha. All right. Sir Brian, would you like to introduce your team and start with your opening remarks?
So Good afternoon, Chairman, members of this committee. I have a very large team with me today to assist with the questions that I'm sure will be posed by the committee and to provide any clarification to the report that we submitted. I have with me today the Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie. To her left is our Acting Principal Finance Officer, Mr. Donovan Davis. To his left is our Director of Policy and Planning, Mr. Howard Lynch. Behind Mr. Lynch is our Director for Emergency and Disaster Management and Special Services, Dr. Nicole Dawkins-Wright. And beside her, to her right, is Dr. Nadine Williams, who is our Director of Health Systems Planning and Integration, colleague from the Ministry of Finance. Oh, I'm sorry, our chief epidemiologist, I omitted Dr. Karen Webster Carr, is to my very far left at the back there. I'm excited to also introduce, Mr. Chairman, members of the team from the Executive Office of the Permanent Secretary who are going through the development program, and they're here to just experience what we go through, because there are PSs in making. So we have, to my far right, Mr. Andre Poiser. We have Ms. Kimberly Nain, and we have with us a Jamaica House scholar who has been graciously assigned to us from Office of the Prime Minister, Ms. Annabelle Jones. All right, so that's the team here. Pardon me for forgetting person's name. But this is a presentation that we have prepared. So in the interest of time, Chairman, I will just turn over to the Chief Medical Officer, and she will take you through the slides that we have here.
Hey, good morning, everyone. Just briefly to provide an update as to the present epidemiological situation in the country. So as of December the 2nd, we have 10,911 confirmed cases. On that day, we had confirmed 47 new cases. So that would make us now have 10,392 locally acquired cases. 784 are locally transmitted, not epidemiologically linked. 1,339 are contacts, and 8,033 under investigation. Next slide. This gives us a picture of the COVID-19 cases by parish. The top picture represents the cumulative number of cases since we had our first case in March, and the bottom picture gives us our active cases, 716 that would have been confirmed over the last 2 weeks. At present, we would have 3,888 cases that are still designated as active cases. I just want to note the difference between the 3,888 and the 716 before. It's actually 716 that have been confirmed over the last 2 weeks, but there is a process to release persons from our register of active cases, and there are a variety of reasons sometimes why we're unable to contact these persons and to verify their information to be able to take them off the register. But in fact, it is 716 cases that have been confirmed over the last 2 weeks. The period that we would keep persons in quarantine or isolation would be 2 weeks unless there is another situation where their symptoms are not improving, where they would continue in that state. We have 259 deaths. We have 36 coincidental deaths. And just to remind the members that coincidental deaths are deaths where we would have a COVID positive, however, the cause of death was noted to be something else apart from COVID. We have 30 deaths that are under investigation, and those span a wide period, some of them probably coming from maybe September. And these cases, we are actually waiting on enough information to be able to classify the cases. As tedious as it seems, sometimes it is difficult to get the information from the point of care where the information would reside, and also to do some of the investigations to be able to compile the necessary information to be able to classify the death. Next slide. This is what the epidemiological curve looks like at present. And as you can see, as of the 1st of November, well, let me go to the next slide and just to show you, no, let's go to the other one first, right. So the top slide, the top picture in this slide would show where we were up until the 1st of November, where you would have seen that we were more or less trending down. And that would have continued into about the first week, going into the second week of November, and then you would have started to see that we've had a slight increase in the number of cases, and we are still trending up in terms of our general direction in the number of cases. We can go back to the slide before. Right. This gives us an idea of what is happening across the different parishes. We know that some parishes we have a low number of cases, and you can look to your right at, and you will see St. Thomas and Portland, where the number of cases are few. But generally speaking, you would see that despite the cases are few, there is a small uptick in the number of cases. In comparison to when we look at our western and our northern parishes, in particular, Westmoreland, St. Anne, where you can definitely see that the end of the chart is a lot busier, and we're having an increase in the number of cases. Generally speaking, in the northwestern parishes, this is where we're seeing more of our cases now. So despite the fact that our numbers are always going to be higher in parishes like Kingston and St. Andrew and St. Catherine, because of the large population, the actual per population rate you would see is also high in some of those northwestern parishes. Go forward again. In terms of our testing, we have just under 120,000 tests that we would have performed up to now, and as we have mentioned before, 10,911 positive cases, which will put us now at a 9.3% overall positivity rate. This is what our weekly positivity rate looks like, and the last entry on the chart would not be complete because it would be to the week to date. So you would see that at the end of the week, that number may change. However, you will see generally there is still a decrease in our positivity rate, not very, very pronounced as we would want to see it, but definitely a trending down. These are the communities that have been highlighted here in this chart, where it is that we are seeing our active cases. And outside of Kingston and St. Andrew and St. Catherine, which are the areas that we would have our largest numbers based on the population in those areas, we are seeing Westmoreland and St. Anne are the two parishes that we're seeing that are filling in, that we're seeing the numbers of cases rising. We're also seeing that parishes like Hanover and Trelawney, where previously we would have not found any cases, for long periods of time we would have had 0 cases, we would see that there is an increase in the number of those cases. Thankfully for St. James, this present map looks less busy than we would have maybe a month ago, but we are still continuing to see numbers of cases in St. James. This gives the top 20 communities with active cases, and these change periodically because we look back at the last 14 days and we do a mapping of where the cases are, and we will be able to put where it is that we have the most active cases. Again, we will see that the northwestern parishes, along with Kingston and St. Andrew and St. Catherine, are where we're having cases. This chart gives us an indication as to where it is that we need to engage more with the communities, and wherever we have communities that come up on our top 20, we would have had interventions in those communities, or interventions are planned in those communities to increase awareness, to make testing more available, and to try to cauterize any problems that we have in those areas. This gives us an idea of what's happening in terms of our deaths, and you will see that the line graph, it would be the deaths, and you would see that those have been decreasing over time. Fortunately, we have not seen the kind of increase in the numbers that we would have seen in September in terms of the number of deaths. And just to say that our projection for December is that we would be seeing an increase in the number of cases, but our aim is really to keep the number of deaths and hospitalizations down. This is just an indication that the males are still where we're seeing our highest number of deaths, with 142 deaths in males compared to 117 females. This gives us an indication of the age distribution, as we would have pointed out, and it has not changed. The older the person is with COVID, it's the more likely we are going to have more deaths in those age groups. And that's the update as of December the 2nd.
Mr. Chairman, if you could just give us a moment to do some logistics. We are told that we need to move up. So Mr. The three of us. Yeah. So, Chairman, the PAAC did give us some questions that we were to provide answers to. I don't know if you want to go through those questions, or is it that you would prefer to just go to question and answer?
The members have the report themselves, so since we are a little bit short on time, let me just go directly to the members for any questions that you may have for the Ministry of Health. Member Hannah.
Thank you, PS. When I was looking at the map and St. Anne, I was pleased or relieved that I didn't see Southeast St. Anne in the matrix or in some of the areas, but it's not cause to be despondent. And the concern I have, and I don't know if in your research and the persons that you had that you have brought, and I do see the Ministry of Health workers in my constituency going through doing the surveys. I can tell you that it's like COVID now keep in many of my communities. I mean, I'm still enjoying dead yards and 9 nights, and there are hundreds of people who come through. And I know it is difficult for the Ministry of Health to monitor the hills of places like my constituency, or even the member from North Trelawney or even Northwest St. Anne. So I'm asking you, at what point do we strike a balance? because the Prime Minister has given certain indications about how many people at funerals, weddings, but there are other cultural practices outside of Kingston that sometimes are not touched on. The grave diggings, the 9 nights, the candlelight vigils. There are a lot of the farmers' days. And those things are very real issues. And I want to know from you, how we strike that balance? I mean, I know you don't have the manpower to do it, but I wouldn't want to see any further breakout in St. Anne or anywhere else for that matter. Are the masks alone the only thing? Or is the Ministry of Health going to come out with some other protective mechanisms to ensure that regardless of what we practice, that we keep the levels down?
So I'll turn over to the CMO to provide further technical response. But the reality is that this now becomes a matter of law and the adherence to the law. The Disaster Risk Management Act is very clear on the gathering limits of 15 persons or less. And you're right, it's around that balance between what the security forces want to implement, have to implement, and keeping that social fabric within the community. It's a difficult question to answer, and from our perspective, we take a public health perspective. And the public health perspective is that we value lives over all else. And therefore, we see gathering as a risk to the public health imperative. And therefore, we are adamant that we must maintain the gathering limits, the mandatory wearing of masks while in public space, washing of hands, sanitizing, and keeping 6 feet distance as a measure to protect lives. Now, a lot of persons, especially because I consume social media, and a lot of young people on social media argue that, you know, it's the old persons who are getting severe illness. What they're not seeing is a connection that they may be asymptomatic or very, very mild illness, but they take it home to grandma. They take it home to a cousin that might have comorbidity, and they become severely ill, and they get a negative outcome from the disease. And therefore, it is the communication that we have to constantly beat into persons. Now, it's very difficult. As you know, behavior change is a very complex social science, and it's a complex thing to achieve over a limited amount of time. And so it's a challenge, and we constantly have to beat the message into the population, but it must be accompanied with compliance to the law. And therefore, once you see those gatherings over the 15, it's supposed to be reported to the police, because the compliance with the law is not a public health, to the DRMA in that is not a public health response. It's a national security response, and the police must get involved and apply the law as prescribed. CMO, I don't know if you...
I would just want to add that there are 2 ways that we're going to stop this disease. It's either we're all going to acquire immunity, or we're going to stop the transmission. The acquiring of the acute immunity may come with the vaccines. We don't know how many persons have to be infected before we acquire that immunity as a population. So what is the tool that is left in our toolbox? We have to stop the transmission. And stopping the transmission is pretty much the same things that we have been preaching all along. And it really is about personal responsibility. The bottom line is that everybody has COVID. And that's why I'm that distance from Pierce and that distance from Mr. Davis. Everybody has COVID. And until everybody in Jamaica accepts that, and put in place the measures that are going to be sufficient, whether or not he does have it or he doesn't. But I'm protected. And we still have to get that message out. It's a message that everybody still has to preach.
Emma Hamilton. Yeah.
Through you, Mr. Chair. Madam CMO, a couple weeks ago, I saw a report similar to what you gave today. And it was a particular community in my constituency that was highlighted as being adversely affected by the virus, Kinloss. But this week, I see an entirely new community that is being affected. Can I assume that the fact that the community of Kinloss is not reported today, it is safe to say that the spread is under control in that community?
I can't say specifically because I don't have the specific numbers in front of me, but I would just want to answer generally. There are several communities that we would have gone into that we would have had high numbers. We've done our interventions, we see some response, and we see the numbers go down. But then by the time you come out, 2 weeks later, 3 weeks later, you see the numbers go up again. Because persons don't, the change of behavior is not there. It's just a temporary enforcement of measures that happened. It's not the change that you want to see. We didn't put up a map where we showed the cumulative communities from March. And what that would have shown is that almost every community in Jamaica has been affected. And so therefore, every community has the potential that your numbers can increase. So I can't say that you're safe. I would say that because it has happened, and because you've had increased number of cases that put you on that top 20, you need to do everything to ensure that you don't get back there.
We have enjoyed just...
And discrimination. It's around the fact that because there's such a high level of stigma around the disease, especially in some rural communities, persons are not coming out to be tested. And that encouraged, because the only way that we can really impact on the disease in terms of stemming is if we know the status of persons within this as physical space. And testing is very important. So sometimes, as the CMO says, that we can only get the results from the people who come and say we will be tested. But there are persons in the community who go under the radar who don't want to be tested. And so the numbers come down. But when you leave now, they begin to impact and affect other persons, and so the numbers go back up. So the message I really want to send is around testing and the importance of testing to the fight against COVID, and the need for persons to not be fearful of knowing your status, because it's an important prevention method for becoming severe. And if you know your status and you know that you're positive, you can also prevent other persons from becoming infected over the long run. That's a very important message that we are beginning to see as an important tool in the overall fight.
Just a follow-up question. I'm not sure whether or not certain activities within certain areas are affecting the numbers, but for example, mention was made of the northwestern section of the island and the uptick in the virus there. Is there, if any, a correlation between the resilience corridor that we have and the numbers within those areas?
No, I'm saying it's a very difficult question that you have asked. Right. Epidemiologist.
Okay, thank you for the hard question. The parishes that are currently affected, or the rates are greatest along that line, Westmoreland, coming right around to St. Anne. What we have noticed is that there are few persons who are working in the tourist establishment. From one parish, it's about 45% of their cases. So we're not making a link. But what the persons have said on the ground is that it's related to more parties, clubs, etc., that are fueling the surge of cases. And the disregard for the protocols in public spaces. So this is what we're hearing from the ground. And we have done a few studies, focus groups, and this is what is coming out. Thank you.
Member first and then yourself.
Thank you, Mr. Chair. PSN team, I noticed that Northwestern St. Anne is one of those constituencies that has had quite a bit of increased spike in the virus. And I do agree with Member Hannah and others who have actually expressed that the culture and the social gatherings, policies are not being adhered to as we would like or should be adhered to. However, as part of your plan, your response plan, I noticed that the health system response you have down as a main focus, and I can speak on behalf of St. Anne Northwestern and also other constituencies where we're looking forward to the development to come in terms of the health centers and so on. I know that there was a plan presented recently by representatives from NERA as it relates to the development of the Brownstown Health Center. And we're looking forward to that because if we had testing and other things happening a little bit, nearer, and even for the runaway base section, that health center is very small. And I'm in a process of writing a letter because we're looking forward to the next financial year for us to get that health center bigger space for that geographic area, because we have quite a bit of persons living. There's a concentrated area, and so we're looking forward to that, and I'm sure there are other areas too that will benefit from that. So yes, the culture must change, and we have our parts to play, as well as the security teams, but we're also looking forward to that development coming particularly in that constituency as it relates to the Bamboo area is also another area where that health center is very small and could do with some work and development, because persons from that area is the nearest place that they would be able to get any form of what you call it in your, is it a stage 3 you'd call it, or a stage 1 health center or facility? Right, with certain offerings then services would be in the neighboring constituency, which is in St. Anne's Bay. Right, so we're looking forward to that. I believe that would help too, and I know that that's a work in progress based on what I was told by the team from NERA recently. Also, my concern overall is I noticed with your bed space, we have 10 beds available in ICU, 5 occupied, and you did put in your report that, of course, it's something that we have to manage because of, what we are able to do and the strain on our health system. But just checking to see if there are any plans for this number to be increased at any point. Just asking, should we really get worse and more persons need to be in ICU? What are we looking at here?
I'll turn over to the CMO, but just to say that the expansion of the ICU spaces in hospital is part of our overall strategy to improve health system delivery. But the ICU space improvement is contingent on a lot of variables, to include staffing, and specialist staffing, especially nurses. And so that strategy we are working through to get the specialist nurses for intensive care and the like. CMO.
Right. So I just want to say that if you're keeping track over time, you would have noticed a difference in the numbers of spaces. And what you're seeing now is less compared to what would have been there before, because we do scale up and scale down based on exactly what PS says. So for this COVID response, we have increased our ventilator capacity to, I think it's almost 100 that we have in the island, and this would be divided between ICU and HDU spaces. Now, but a functional ICU space is not just a ventilator. It's all the other paraphernalia, including most critically the staff. So some of our hospitals do have spaces, but we would not have them fully available now, but we're ready to scale up in case. So just like how we scaled up August, September in terms of the number of spaces that there were, and then we scaled down based on the demand, we have the capacity to scale up our response at this time, just as we did. But it does require more nurses, in particular, critically trained nurses. And at times, we would have to pull from other areas in order to be able to establish those spaces.
Member Clark.
Thank you, Mr. Chairman. My addition to all that is being said, Mr. Chairman, is that COVID is a situation wherein it is very easy to spread. We will never have enough space to accommodate an upsurge or the spread of COVID, as we know, because you have to separate, you have to regulate the situation. And therefore, I believe that we must deal with it from the root, which is the first part of it, to spread the message, keep away. And so, as representative, we have to carry the message in partnership with the ministry to make sure it is better to stay away than to try and ask the service of the health department to take care of us. My take on it, I have been around, especially in the West, where I'm from, and I've seen many parties, many funerals.
I don't report them.
Sorry?
I don't report them.
I have done my fair share of reporting because I believe in the government of the day. And therefore, I will do all that I can to make sure that this government looks very good. So I've done my fair share. But I still want to echo the sentiment that as the ministry, who is at the back end, first responder, but also at the back end of the situation, for them to appeal more to their colleague ministry, which is the security ministry, to play a more concentrated effort on controlling the situation as is. I believe the very day that we start to penalize persons for not doing what they ought to do where the protocols are concerned, then we will see a change. And nobody tell us that, boy, they don't have to wear a mask because the next person is wearing a mask. All of us need to be wearing masks. I've been to business places, and the staff, the employee saying to you, where is your mask? But they don't have on a mask. And I'm saying, why is it that you're telling me to wear a mask when you don't have one? They are colleagues, so they know they want to. No, you have to safeguard me, the client that is coming into your business place. And so, from time to time, I said it before, and I'm saying it again, the ministry need to have officers who will go out to investigate situation. It might be a wayward situation, but at least something must be done to see that, yes, the entities are following the protocol as is.
All right. Thank you. Member Whittle.
Thank you, Mr. Chair. This is for the CMO. You mentioned that practically every community across Jamaica has cases of COVID-19. I know that in the earlier stage, you were able to be very effective with the contact tracing. I know it would be more difficult now that we have the community spread. How successful is that now, the contact tracing, given the fact that, you have it right across the various communities across the island?
Contact tracing is still one of our most important methods of detection and control. And I've heard in some forum people say that we're not contact tracing anymore. No, that's not true. That's a backbone of what we do. And as a matter of fact, many of the cases that we would have seen, you would notice like clusters in families. So some of the communities that we would have seen, you would see 5 people in a family. Starts out with 1, and then we do the tracing, and we are able to find the persons that they're in contact with. So it is still the backbone of what we do. It is still our the most pickup of cases come through contact tracing. So I don't know if Dr. Webster want to add anything else, but just to say we are doing it still very effective. It gives us our highest pickup rate in terms of the number of new cases that we're seeing, and it is being carried out in every single parish. This is what our health teams are working on a daily basis, every single day.
I understand, but I was just trying to make a comparison now as against earlier in the outbreak. I know you would have difficulty with staffing and so on. Mm-hmm. So how is that challenge? How difficult it is now, given the fact that you may have had to use more persons now, which might not be available to really...
Right. So we have increased our staff cadre to assist with contact tracing. You would have recognized that we would have announced the engagement of over 1,500 or the establishment of posts for over 1,500 community health workers. I think we have engaged maybe about 1,200, about 900 of those already. So that has significantly boosted our capacity. We're able not just to go into the communities when we have cases, but we're actually able now with that establishing the ratio of 1 community health aide to 1,000 population. We're able to much better penetrate the communities. So contact tracing is more effective now with the numbers that we have on the ground. So in terms of staff, that was one of our big push, to be able to get the staff to be able to do contact tracing. And we have tailored the training of these new community health aides to have a module on contact tracing so that they're better able to carry out their function.
Just on that, those 900 community health aid PS, and this is more for you, are they being included in the establishment?
So, yes and no. So what we got approval from the Ministry of Finance, given the emergency transaction that we had to do, was a temporary approval for 2 years. So we got temporary posts for 2 years, because there's a process of rationalization that has to take place for the entire primary healthcare system. That is now being done. That is now being finalized for submission to cabinet. And that reform of primary health care will not only look at the cadre of community health aides that we have, but in terms of all of the health staff, our health workers that support primary health care, which is part of our overall 10-year strategic plan to begin our more focus on preventative interventions for public health.
All right, so I'd hope in that rationalization, those community health aid workers who you had there that were still temporary staff would be included before the new ones on the establishment.
Well, the regions who, as you are aware, Chairman, would be responsible for the employment of staff, they are doing that rationalization in terms of some community health aides who would have been working with the regions before, who would not have had a post assigned to them. Those were persons who they began to rationalize first.
No, that's what I'm trying to establish.
Yeah.
All right. Thank you.
Just to make a note,
Sure.
Chair, that the community health aid is a part of a team. And so they don't operate on their own. They work with the public health nurses, the medical officers of health. And outside of the community health aides, there are several other community health workers that we utilize for the program in terms of doing the contact tracing.
Thank you. Member Hamilton.
Mr. Pierce, what is the status of the field hospitals? I am aware that there was a report that the hospital in Trelawney would have been completed on November 30. Is it ready? And what are the numbers being housed currently by the National Chest Hospital site? And is there any positive impact on our hospitals now through the freeing up of bed space, for example?
Thank you for that question, member. Because of the weather, we had almost 4 weeks of rain, and that 4 weeks of rain has delayed the 2 field hospitals that we're building out, one at Falmouth and another at St. Joseph. So the expected timeline now for the completion of the field hospitals is mid-January, mid to late January, all things being equal. The impact of the field hospitals overall, especially the one at the Chest Hospital, I will turn over to Dr. Dawkins, right? All the way to that, or Director of Emergency Medicine.
Thank you for that, Chair. Thanks, Pierce. As it relates to the utilization of the donated field hospital that we had gotten in September, there is a process for the activation of the facility for its use in our search plan. And as part of that search plan, we have various components to it. So there is a trigger mechanism for its utilization, and that would depend on the bed occupancy at the time and the need for the placement of patients in that facility. Up to date, we have not met the criteria to operationalize that facility, and so we will continue to review the utilization in terms of the use of that facility for the surge demand in terms of cases. So we have on paper a plan as it relates to activation of the facility should the trigger be made.
Well, just follow up on that, because seeing that we had a surge during the independence period. What are the projections now post Christmas, and would that tie in back to the preparations of the field hospitals?
So our projections that we would have presented to Cabinet is that, yes, we do expect an increase in the number of cases over Christmas going into January. We have actually started a little bit early because we are seeing our curve going up. Our projection was that coming out of Thanksgiving week, 2 weeks after that, with the increased amount of travel that occurs during that period and then increasing steadily going up to Christmas, 2 weeks after that was when we would have started to see the increase. So it is a bit early for us now, since the last week or so of November, even a little bit before that to have plateaued and then to start to turn up. So we are expecting an increase in the number of cases. We have done a lot of work during the month of November to prevent hospitalizations. We have done several community interventions. We have revisited all our infirmaries or nursing homes or everywhere we have dormitory facilities or children's home, prisons, lockups. We have done a lot of work in those areas, increasing their awareness, their knowledge, testing. All of those, we've tested over 3,000 residents and staff for infirmaries and all of those areas over the last month and a half, just to ensure that despite the fact that we expect the numbers to go up, we don't want our hospitalizations to go up. Presently, we are at below 50% capacity of our COVID beds. Now, during August, we went up to about 70 to 80%, about that. So we know that we can manage that because we did manage it in August, September. So our projections right now that despite the increase in the number of cases that we expect is that we will maintain our levels of hospitalization within our capacity to manage. So we do have as I said, less than 50% occupancy now. We do expect that that may go up to 70, 80% again end of December going into January. We have the field hospital that is in Ireland ready to activate in case we go over our bed capacity.
What's the time frame to have that operationalized if you do see the surge?
2 weeks. 2 weeks is the activation. The plan requires 2 weeks. So once we see our numbers going up, then we would be able to trigger the starting of getting the staff in place, getting everything in place to activate it. And by that time as well, we would have the 2 additional ward spaces at St. Joseph's and in Trelawney ready as well. So we are prepared in terms of bed, or we are preparing so that we are able to meet if we go beyond that 70 to 80% of bed capacity. And also bearing in mind, of course, that this is our busy time of the year for hospitals, so it may take a little bit less than that to trigger our use or need of those additional facilities. So we are putting those things in place and be ready to act if we see this happening.
Just with the regions have been tasked with the payments of the daily subsidy for the COVID workers. Can you give me an update if they're meeting those? Are they up to date in the payment of those subsidies, or what is the status of it?
So the report that we have up to the end of November is that the regions are meeting the obligations. What we have are individual cases of some individuals who may have had salary glitches, and so an allowance would not have been paid because of some calculation. So they are outliers in terms of the overall process. So to answer directly, we are up to date. It is to be noted, though, that allowances are paid 1 month in the back. So a lot of times persons expect to see, once they submit, they expect to see it in the next pay cycle, but no, it actually happens in the pay cycle after that. Because so for example, the pay cycle for December closed on December 2, yesterday, December 1. So the pay cycle for December, so anything that you wanted to get paid for the 25th of December, or whenever we're paying in December, has already been closed. So a lot of persons don't understand that mechanism, so they would have submitted it. It's like the 20, like they would have submitted on December 2, and say, well, it can come in my December salary, but no, it would now come into your January salary.
And those glitches hopefully will be worked out by the time
Yes,
the next cycle comes.
Yes, the regions are very committed to, because as part of the overall staff welfare program, we understand we don't need to create any more anxiety within the health sector where persons would have worked very hard, very difficult situations, and then when it comes on to their financial obligations, they are not able to meet those. So we are very conscious of that because we are focused on, in this period, especially on staff welfare.
My final question to you, really, in preparation for the vaccine, yeah, do we have any facilities here currently in the island because listening to the reports need something like a negative 70 degrees for storage. Do we have that facility here?
I'll allow the CMO to finalize on the answer to that directly, but it all depends on which vaccine we choose. Not all vaccines.
Well, if you can just give us an update of where we are now on the vaccine itself, seeing that there are reports that we're just close to hitting the streets, and where we are as a country in preparation for that and then I'll follow up with my other questions.
Sure.
Right, so Jamaica will obtain its vaccines through the COVAX facility, which is a facility, a part of the alliance with WHO and other organizations to provide tools for COVID. So the COVAX facility is a vaccine arm of that. Now, the vaccine that requires the minus 70 degrees conditions for storage, that is not presently included in the COVAX facility. So the other second and third runners after that, those are included in the COVAX facility, and the probability would be that more than likely those would become available to us. Now,
but the COVAX facility. What quantity would we be getting through that facility?
We would be getting for 15% of our population, which would be the initial phase of the vaccine would be for the healthcare workers and for the vulnerable populations.
And then for the other 85%?
Well, the other 85%, there will no doubt be a phase 2 of the COVAX. Initially, what the alliance is about is ensuring that all countries, whether great or small, have an access to the vaccine at a reasonable cost. And so the initial aim is to provide for that first up to 20% of your population. I think it's 90-odd countries that are part of this alliance. And it is to ensure that these countries all are able to get for that first phase where the most vulnerable persons in the population and the healthcare workers who are administering and would be at risk for spreading to other persons would receive the vaccine. Now, the second phase of it would probably be looking at another percentage of the population where you'd go to your next tier of persons, and then we would also have to be negotiating the price for that second tier. So we will, after the first phase has commenced in terms of one, WHO PAHO stockpiling the vaccine and being ready to distribute, then I would imagine we'd go straight into the second phase planning, which would be for the next set of persons within the population.
And the reason why I raise it, because during the election campaign, the Prime Minister had made a promise that all Jamaicans would get access to this at no cost to each Jamaican. So, in knowing what phases, so the first set that will probably benefit from it are your most vulnerable and your healthcare workers, which we accept. And then you will start planning for the second phase.
And then, more than likely, a third phase.
Right. And we do have adequate storage, as you said.
Initial
question,
Just to say, sorry to cut you, that the other vaccines, the storage conditions that are required are conditions that we presently have in country. So this is the minus 20 degrees that you would have heard associated with another type of vaccine, and this is the present. This is like in your freezer. So we presently procure vaccines, for example, the polio vaccine, the MMR vaccine, that are stored under those conditions, and so we do have the capacity for the storage and transportation of those vaccines. This particular vaccine, that's the minus 20, remember this is the storage where it is stored for up to 6 months. It can be under those conditions, but then up to 30 days, once it's taken out of that, it can be stored at 2 degrees to 8 degrees, which is your normal conditions in your refrigerator. So we would be able to deploy it to rural areas, etc., for it to be given to the population. So we do have the storage, but no doubt we are using this time as well in preparation to assess how much additional storage that we would require. But it is not at the level of trying to get the minus 70 fridge.
No problem. That's understandable. Because I'm trying to get, because if we're talking about 15% of the population, you're talking about probably 30,000 initially.
I think that it works out to be about 500,000.
About 500. And is it one cycle of?
It's two doses,
cycles?
so it's about maybe a million, close to a million doses.
That you will get in the first phase?
Yes.
All right. And at what point, so all that we would probably need at some point, we will have to basically buy some of this, the vaccine itself.
Well, for this 15% of vaccine, we are procuring that. We have been
through the facility.
Through the facility,
okay,
at a reduced cost.
Yes.
So, and we're supported through the Caribbean Public Health Agency, who has put forward some funds to assist with that initial down payment, where we had to pay a 20% down payment. So we would have made that down payment already on the vaccine.
What would be the overall cost, the subsidized cost?
Yes.
So the subsidized cost for the 20% is around 8.2 million US dollars. And we have had the initial deposit of about $1.1 million through CARFA, which is the Caribbean Public Health Agency. And so the balance we are programming for fiscal year 2021-22.
22.
Right.
Yeah. And I'm hoping that within that budget we're looking at the second phase also.
Well, it all depends what happens in the first phase. Now, the first phase we are anticipating to last a good 6 months or so, because remember now you have to first give the first dose, and then there's a period of time that you get the second dose. And then you go into the whole rollout of the second phase. We are not anticipating that we would get the first dose of the virus until about the vaccines.
You're excused.
Exactly. When I anticipate that we'll get the first dose of the vaccines until perhaps the second quarter of the calendar year, which is the first quarter of the fiscal year. Yeah.
Okay.
So, as you know, the first world countries are going to crowd out the market in the first, say, 3 or 4 months until production reaches to a level where all of us mere mortals can participate.
Without the subsidy, what would it cost?
Well, I think it was like $30-something a dose. $30 a dose.
Per dose, and with the...
I think it's 37 from your report.
Go again?
I think it's 37 from your report.
37 or so.
It's 10, you get it for $10.55.
Yeah. So
$10.55 per dose, so we get a substantial decrease in the cost. But going into the second phase, we may not have the same
No,
price.
which is right, which is what I'm trying to establish. You know, so the first is going to be heavily subsidized. The second, we're not sure yet what the subsidy, if any, will be. But at the subsidized, the first dose that we get will be at what, $8 million US. Yeah? So it is not a cheap undertaking by any means at all. Members, you have any questions on Member White?
So, Chair, I think this is for the PS. Given the negative impact that the virus has on the education system, have you ever contemplated giving priority to students in the first phase of the distribution of the vaccine? Because I think we don't want to get the education system back on track.
I don't. Through you, Mr. Chairman, that's not a question for the PS. That's a question for the CMO. The reality, though, member, is that we have had instructions. A cabinet decision has been made on the first phase already in terms of the list, the priority that the CMO pointed to, in terms of the healthcare workers, the vulnerable, mean the elderly in the most instance, and persons with comorbidities. CMO?
Right. This is not just a national situation, so it's not particular to Jamaica that we would have chosen this way to go. I mean, internationally, and not just now, but historically as well, you would go to the most vulnerable persons, and then you'd go to the persons who are delivering the healthcare, you know, and so the healthcare workers, it's important that they are safe to be able to administer to the population, but also healthcare workers are at risk, high risk of developing the disease and therefore spreading as well. So it's very important that they are vaccinated. And then, of course, you'd go to the next vulnerable sets, which are the aged in this situation. So we understand the situation with regards to school, but fortunately, the young persons right now are not the ones that are most vulnerable when it comes to COVID-19. So worldwide, you would see that they're going to the nursing homes, they're going to where the vulnerable persons are, that's where they're starting in terms of the vaccination. Persons with chronic diseases, you want to protect those persons quickly.
I was not really looking at the first phase, you know. I was thinking about when you go into that second phase and start to deal with the issue of priorities and given the restraint as it relates to finance and so on. Maybe you could look in the second phase.
Most definitely, and it's something that is going to be subject to a deliberation. The minister has convened a special COVID vaccination commission, and those are the types of deliberations that will take place. And it's a multi-sectoral committee that brings together private sector, public sector, non-state actors, etc., to tackle those other complex issues. But one of the main things that we need to do around vaccination now is tackle the whole issue of reticence, want of a better word, and suspicion, and people, conspiracy theories around vaccination, etc., etc. It's going to be a major impediment to us achieving the objective of inoculating the population. I know if I do that, I should do a straw survey right now to say of the persons seated in this chamber, if the vaccine were to be presented at the front there, how many of you would take it?
You'd have to beat me to the line.
Well, this is very good. Well, it's a very, very good.
But that's a serious issue, and I think even just looking onwards now, and some of the comments publicly, radio stations, and just around our constituencies, you have to start a public relation drive now, not wait until next year when you're about to get the vaccine. Otherwise, you're going to have problems. And I would suggest that that drive starts anytime now in getting persons just knowledgeable on the vaccine, and it is not just something that somebody's trying to make the whole black people, as some been uttering. But, something that needs to be done. But I just want to make sure that the Prime Minister's promise that it will not be at cost to Jamaicans is one that is upheld, as was made during the campaign period. And that even though it is at a significant cost to the taxpayers, it is something that we need. We're basically seeing the damage to the economy and worldwide economy that this pandemic has cost us, and any vaccine that can help us right now. And we know that quite a bit of our population would be out of the reach of many of our Jamaicans, especially the most vulnerable. Hence why we have to make sure that that promise is kept. All right, members? Any other? Member Lee, I see that you want to say something more. Oh, I thought you were. It will be kept. No, I'm sure that the Prime Minister will keep his promise. Yeah. So why are you attacking me now? The anti-agent testing, just finally, is...
Antigen?
The antigen, and there were some private labs that were supposed to be brought on stream. Any updates on those?
Yes, well, we have started with both. We have the one private lab that is now actively doing testing for PCR, and we are getting reports twice weekly from them in terms of the number of tests that are being done. And then we have rolled out the antigen testing, first of all, in our public hospitals. So we have 3 hospitals that are on board now that have started. The process is, we're not going to see the huge amount of tests coming out of the antigen testing right now, because we're testing, the test is for symptomatic persons. Mm-hmm. And so therefore, even so far from what we have done, the majority of the cases would have come back negative, and so would have gone on for PCR testing. Okay. So we don't expect that the antigen testing is going to increase our numbers significantly, because very few, based on our positivity rate, if we're running an 8% positivity rate now, if you do 100 tests, 8 are going to be positive. Mm-hmm. And so the balance of it, 92 of them would go on to PCR testing, which would go to the public health lab.
Okay. All right. Thank you very much, members. Any final questions to the Ministry of Health? All right. Permanent Secretary, let me thank you, one, for the patience for being here on time and having to sit through another ministry. And I hope that all goes well with the vaccine. And if we might not meet like this again, so a Merry Christmas to yourself and the team. All right? Team? All right, any other business? No other business?
From us, Mr. Chairman, I know you did make mention of the Merry Christmas to the team from the ministry, including Permanent Secretary and Chief Medical Officer. But from us, we want to say continue the good work that you have been doing. You have been carrying us thus far. We want you to carry us some more. With the help of the Almighty, He will give you the strength and knowledge and the understanding to do it. And we stand riveted behind you, beside you, to make sure that the energy and the push that you need, we'll give it to you.
Thank you, Chairman, and thank you, members, for the record.
All right. Members, as I said at the opening when we were starting, that this is most likely will be our last meeting for this calendar year, and we'll start back in January. And I had mentioned to you to at least give me as chairman the latitude to at least set the date with the clerk for that first meeting in January. Normally we would have to meet too, or she will send out a schedule, right? So, no, she will send it out, right? She will send it out to get the, but again, members, I ask that once you get the emails that you respond to them on a timely basis so that we can move forward, all right? And the adjusted schedule will be circulated so that members can see what it is we're working with. All right? So, meeting adjourned.
Expansive tropical forests, majestic rivers and mangroves,